My name is Jason Rutz. I head growth and partnerships for Freedom Healthworks. And we're going to talk today about how direct primary care can lower costs. So a lot of people ask why health insurance is so expensive. To understand that question a little bit more, you have to look back at why health costs are so expensive. When you spend $1 in a traditional health system, there are a lot of middlemen that take a portion of that dollar and whittle it away until it gets back to the provider that's actually performing the service. So what they receive is actually a fraction of that dollar that you spend. But in between, you have hospital administrators, you have insurance administrators, you have networks that take a portion of that. And so that's why health costs are so expensive, because people want to have a bigger piece of the pie to take their portion of. And so there actually have been a lot of attempts to lower the cost of health insurance. But unfortunately, until health costs are reduced, it makes it very difficult for insurance premiums to reduce in accordance to that. So another question I get a lot is, why aren't healthcare prices transparent? And really it comes down to complexity in the system. So because there's so many hands in that healthcare dollar that you spend, it's really hard to track that from beginning to end. And so therefore it makes it really tough for you to understand what the prices are that you will be paying ahead of actually getting that service performed for you in the hospital or in a doctor's office. And unfortunately, the healthcare system has been so complex for so long, consumers don't realize that transparency is there, that they can find it, and it's difficult, but they can find it, and it exists, especially in direct primary care. So direct primary care can solve a lot of these issues. And it's precisely because instead of having that dollar that you spend in healthcare whittle away till it gets to its end point, essentially you're direct contracting with a primary care physician. So that means every dollar that you spend actually goes to the physician. And so because of that purity within the model, it becomes very affordable, and there's a lot of value on direct primary care. So that's why you get a lot of service. You can have a doctor basically on retainer that's available to you that you can see unlimited amounts of time for a very reasonable monthly fee. Because we direct contract with lab companies, we're able to bring a much lower price than having to run through your insurance. The same thing can be done with prescriptions, where we have partners that provide wholesale pharmaceuticals directly to the patient. And we're actually starting to see a movement within healthcare for things like surgeries, mammography, colonoscopy, that can be direct contracted, meaning that we know exactly the price that a consumer will pay for those services. And so all those things together, in conjunction with direct primary care, is kind of the driver of it, will help make pricing not only transparent, but help lower costs long term. So if you're a consumer interested in joining a direct primary care practice, or even if you're a physician interested in transitioning to the model, feel free to contact me via email. It's jrutz@freedomhealthworks.com. I'd be glad to speak with you about all of this that we talked about today and more.